Good morning. Welcome. I am Sanne Magnan. I am the co-chair of the Roundtable on Population Health Improvement, and I really welcome you to today's workshop, which is Achieving Rural Equity and Well-Being, Challenges and Opportunities. And a special welcome to our esteemed speakers that we will be hearing from today. This meeting is recorded and webcast, and I welcome those of you who are watching via the web. We'll take questions and comments from our virtual audience as time permits. Since February 2013, the Roundtable on Population Health Improvement has been providing a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from the challenges and changes in the social and political environment for achieving better population health. The Roundtable's vision is of a strong, healthful, and productive society, which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve that vision. As one of its major activities, the Roundtable holds workshops for members, stakeholders, and the public to discuss issues of importance to improving our nation's health. If you're interested in learning more about community-driven approaches to building healthy communities, I urge you to go to the website on the National Academy's site. I am personally looking forward to today because I grew up in a rural town in North Carolina. I lived through the racial integration of schools in North Carolina, the elimination of separate white and black areas. For example, there was separate seating in our movie theater in our town, and the movement of the Confederate soldier monument from the center of my hometown. I've seen the changing downtown business area, the rightful loss, yet painful loss, of the economic base of tobacco production in my area, and the struggle for a replacement with initial manufacturing jobs that subsequently were lost. My dad sold his independent pharmacy to a national chain, which, to their credit, has fulfilled their vision of having a community pharmacy, where my dad still practices 2 half-days a week at the age of 90. There are interesting partnerships in rural America. In my hometown, the Downtown Oxford Economic Development Corporation partners with the Granville Health System to support the annual, 11th this year, North Carolina Hot Sauce Contest. Go Southern Barbecue. Last year, over 12,000 people participate, much more than even the hometown has. I also appreciate that they are doing a unique partnership that engages the business and the health sector. In rural Fergus Falls, Minnesota, the state where I now live, I have seen and been able to participate in an involving partnership between the hospital and public health, joining forces with others in the town to create, as the CEO of the hospital said, a rural health model, with an active engagement of the community to tackle tough issues. Tomorrow they are having a forum on opioid and heroin abuse with their community stakeholders and members. Through an accountable community health model, they are partnering with the Salvation Army and A Place to Belong for people with serious mental illness to learn together what a rural health model looks like for different populations, and particularly in their county with an aging population. So the impact of the changing demographics and social determinants of health are very vivid for me in rural America in many ways, and I see the spirit of pioneering that is still evident. However, while much has changed in rural America, many deep-seated issues have not changed. And there are vivid opportunities that are missing for many populations. I look forward to today when we will explore those challenges and opportunities in more depth and thinking about the assets that rural communities have that I illustrated in the two places that I know very well. The purpose for the National Academies is to advise the nation. And today we are pleased to join with our sister roundtable on the promotion of health equity and the elimination of health disparities in today's workshop. I want to remind everyone who's in those two roundtables that at the end of the day, my fellow co-chair, George Isham, will invite members of those two roundtables to make brief reflections on the day. So as the day goes on, think about what you might want to reflect on. At this time, I'm going to turn it over to the chair of the Roundtable on the Promotion of Health Equities and Elimination of Health Disparities, Antonia Villarruel. Tony.
Thanks, Sanne, and good morning, everybody. It's really great to see everybody here today. As you know, I'm the chair of the Roundtable on the Promotion of Health Equity and the Elimination of Health Disparities, and we're excited about this roundtable, not only because we're outside of Washington, D.C. For many of us, this is our first time in Alabama, but I think it's an opportunity to address the type of disparities that we probably don't give enough attention to, and that's disparities that occur as a result of geography. We're excited also to be looking at the intersection of disparities from what we look at. Our roundtable is the conveners of the nation's expert in health disparities and health equity with the goal of raising awareness and driving change. Our mission is to advance the visibility and understanding of inequities in health and healthcare for racial and ethnic subpopulations, as well as to take a look at the intersection of those disparities. We want to amplify research, policy, and community-centered programs, and to catalyze the emergence of new leaders, partners, and stakeholders. Our workshop objectives for today are to explore the impacts of economic issues, immigration, and racial inequities in rural communities, and also to learn about asset-based approaches to addressing these challenges. If you are tweeting today, and we hope you are, please use the hashtags that are on the bottom of the agenda that you have. If you have any logistic questions throughout the day, please talk to our staff at the registration table and around the room. Note that in the meeting materials that you have, we have provided you with copies of the presentations that were given to us ahead of time, and we will be posting the current presentations on our meeting page after the workshop, so check back. As we begin the day, I'd like to thank the members of the Planning Committee for the workshop, and I'd ask you to please stand when I call your name. Julie Baldwin, Martha Gold, Jeff Henderson, Dennis Johnson, Octavio Martinez, Phyllis Meadows, way in the back, Alan Morgan, and Tim Size. Our bio sketches for all of our presenters and moderators, including the planning committees, are provided in the meeting materials. So I hope you'll have a chance to get to know them during the lunch as well. So now we're going to move on to the main event. And so to help provide us an overview of challenges and opportunities in rural communities, we've invited two keynote speakers. Our first speaker is going to be Tom Norris, who is the Associate Administrator for Rural Health Policy at the Health Resources and Services Administration at the U.S. Department of Health and Human Services. He will be followed by Michael Merritt, who co-directs the NORC at the Walsh Center for Rural Health Analysis. He's also a Senior Fellow, Public Health at the NORC at the University of Chicago. Each of our speakers will have about 30 minutes for their presentation, and then we will be engaged in discussion for all of us. So please join us and please join me in welcoming our speakers. Thank you.